Yes, I believe we can.
Okay, perfect. So thank you, colleagues from AU-CIDO. I can see my sister Emma there. I can see colleague from Diaspora. I can see Sarah Abdul Ghani. I can also see colleagues from AFOD. So on behalf of the organizers of this important webinar, I say welcome to our distinguished panelists, from Emma to Dr. Sarah Abdul Galil, to Said Sheikh Abdi from IOM, to Abdul Terab, Nigeria Diaspora Commission, and myself, Raji Tajuddin. I will be moderating this 90 minutes webinar. And of course, we also need to recognize our interpreters so that they will ensure that language will not be a barrier as we move forward with this webinar. So, by way of some housekeeping, let me say that this session is going to last 90 minutes. So as much as possible, responses should be as concise as possible. And then to our speakers will be given 10 minutes each, apart from the opening statement. That will be something less than 10 minutes. I know Emma doesn't talk a lot. She will be able to do it in 5 minutes. And to also say that we have an interpretation facility. So just look at the right bottom of your screen. You see interpretation there, so click on it. And you have English and French, so please make your selection as appropriate. So without further ado, let me go straight to what this third in a series of webinar is all about. So the objective of this third and last webinar is to look at the impact of COVID-19 pandemic on our diaspora community, with a specific focus on our health professionals, and of course, to look at how this COVID-19 pandemic has impacted on skill shortages in the health sector in Africa, in terms of skill transfer, and in terms of what is given back by the diaspora community to the populace in Africa. And of course, we will go ahead to explore the different measures that could be put in place to ensure that in terms of development, in terms of infrastructure, and in terms of compensation, what can be done, to address some of these negative impact. And at the end of the day, we should be able to center on the health sector and the diaspora and the migrant contribution to the continent. And we also try to see how do we address the different determinants as far as going forward on this issue is concerned. So to set the scene for this webinar, just to quickly let us know that as of today, globally we have 9.3 million cases of COVID-19 globally. We have over 480,000 deaths, and we have this coming from more than 200 countries and territories. Focusing on Africa, today we have over 350,000 cases. We're still evolving. Some 4-6 weeks back, we were just around 1% of the global total. Today, we are over 3% of the total as far as the COVID-19 cases on the continent is concerned. So we are actually evolving, and we are evolving very, very fast. In terms of number of deaths, we have over 9,000 deaths on the continent. Some 4-6 weeks back, it was less than 1% of the total deaths. Today, we are close to 2% of the total death. So you will agree with me that we are evolving, and we are not evolving in the positive direction. So meaning that more cases are coming, and we are seeing more casualty. So the morbidity and the mortality as far as this COVID-19 is concerned is really, really going up, and there's something need to be done, and we need to put our heads together and see what is it that we can do. Permit me to say that some 4 weeks ago, the Africa CDC and the African Union Commission launch what we call partnership to accelerate COVID-19 testing on the continent. For point of emphasis, partnership, meaning that everybody, including the diaspora, is involved in this journey. And for colleagues who are here, there is none of you that have not, the AU-CIDO has no one way or the other worked with. We are working closely with CIDO in terms of community engagement. As you agree with me, there's nothing we can do without the community, be in terms of response or in terms of interventions. The community need to be carried along, and we are working closely with CIDO in this regard. In terms of cross-border issue and issues of places of detention, we've been working closely with IOM. In fact, on July 2nd, we are going to have another webinar focusing on places of detention, and IOM is fully on board with regards to that. And for my sister, Sarah, she's been one of the key pillars as far as the technical working group on case management of COVID-19 pandemic on the continent is concerned. So this to say that as far as this response is concerned, no single individual, no single country, no single entity can do it alone. So it's all about partnership. So after having set the scene for this important webinar, and the fact that we need to be very conscious of time, I would like to go ahead and invite Emma, who is our head of the Diaspora in the Department of Citizen and the Diaspora of the African Union Commission, to give an opening statement. So, Madam Iman, over to you.
Thank you so much, Dr. Taj. We always appreciate your style of moderation. So good morning and good afternoon, everyone, and thank you for joining us for this third webinar. Like Dr. Taj and the poster has indicated, this webinar is about diaspora migrant health professionals. We're looking for the challenges and solutions for addressing the skill shortages and its impact on Africa. So I think we all know the story of health workers, diaspora health workers. They went to school in their countries of origin. At some point, there comes a need for wanting to gain extra knowledge, more financial resources, engage in fields of pure research, which isn't available in their countries of origin. And then they decide to leave. The majority migrate through regular means, manage to secure further studies, lucrative pay, and continue to have their heart in Africa. So usually they support through the usual channels, remittance, knowledge transfer. The doctors and health workers specifically always organize the trips and caravans where they go back to teach, conduct the trainings, run the surgical operations, and return back to the countries of destination, maybe feeling a little bit better that they satisfied this responsibility toward their countries of origin. But with COVID-19, again, it stresses these new realities. They are in the countries of destination, they can't come back, and you would say that ethically they need to be there at the countries which they were in, even if the borders were open. But the borders are not open, and the support they can give is either monetary or through knowledge transfer. In the country of destination, and as mentioned, data shows that they are in the front line of the response. Data also shows that they are amongst the largest group who loses their lives to this disease. Actually, it shows that Africans or Black and Asian minorities are the most affected. And with COVID-19 and the health challenges worldwide, today, like Dr. Taj was speaking, the US has over 2 million cases, over 100,000 deaths. And we know that this means that after COVID-19 or through COVID-19 as well, as we've seen, that the recruitment of health workers has already started, and it will continue to commence within the global north or the Middle East. But then the situation in Africa remains the same. We have really fragile health systems. So what do we do? In the AU, we understand that the push factors that we need to take into consideration when looking into the situation of this health labor market in Africa. We need to resolve the push factors because the health market is not attractive. There's no retention and growth of health workers, and that sets out the incentives for them to go and seek employment elsewhere. We are engaging in research and study to understand how this migration affects the health labor supply in Africa. Because at some point we speak about the brain drain, where all of them are leaving the countries in need. And it's worth it to take just a minute to explain that even though the brain drain phrase is used widely in Africa, it doesn't always apply, because a brain drain not only speaks about the skilled workers leaving, but it means that the country has invested in these skilled workers. And even though it doesn't apply to many situations in Africa, within the health workers, within the health field, it applies fully. Most of the time, most countries pay the health workers following their graduation. And that's why when they leave, they really cause a big gap in the country. What other things that we are looking at is what systems are in place that supports these health workers who have left, health diaspora workers, to support their countries of origin. Like I think Dr. Taj already mentioned that, but in the area of migration and diaspora, we realized that the only way is to have these win-win partnerships. So one of the things we're trying to do is like to get the countries involved. In the absence of these bilateral agreements between countries, or even the absence of a continental framework to assist member states to support these health workers to go, because it's their right to go, but in a coordinated manner that reduces competition and that doesn't harm the countries of origin. We need to, like maybe the question of today's webinar, and like I really look forward to the conversation, is how do we achieve that balance? We want to safeguard the rights, want to safeguard Africa, but at the same time, we also want to safeguard the rights of diaspora health workers who are aspiring to go and get more. So with that, I'll stop here, Dr. Taj, and I look forward to the conversation. Thank you.
All right. Thank you, Iman, first for sticking to time, and two, for perfectly setting the scene and the stage for this discussion, which once again is focusing on the diaspora community. So I will not attempt to summarize that. So let's move straight to the next item on the agenda, which is to invite Head of Technology Transfer and Innovation, Nigeria Diaspora Commission, Honorable Abdurrahman Terab. Honorable Abdurrahman, are you there?
Hello, I can't see that he's joined us yet. So no, he's not. He's not on
Okay.
the moment.
Okay. All right. Thank you. So I think we just need to move on. I would like to invite my friend and colleague, Said Sheikh Abdi, who is a consultant on diaspora and partnership for IOM. Said, you have the mic. Please grab it.
Good afternoon, everyone. Can you hear me?
Yes, we can. Go ahead.
Yes. Thank you very much for inviting this important webinar. It's great to meet with great speakers as well as many audiences. It's important. Let me go through the points and share with briefly. I think Elman has narrowed down some of the key points, but I'll just take some great examples since I was really involved in terms of recruiting the diaspora in the 3 different scenarios, especially African diaspora, to respond the humanitarian crisis and health crisis in Africa. And I'll take a couple of countries as an example. In 2011, when there was a famine in the case of Somalia, according to the UN, about 200,000 children died. A lot of the diaspora around the world were emotionally, they wanted to help. They were lacking the platform. At the time I was leading a campaign called I'm a Star. And I realized the potential of the diaspora that could offer when it comes to the Africa. So one of the challenges that they were facing was a platform. How can I help? If I'm a healthcare provider, a doctor who has 1 month or to help or 2 months to help, how can I help? How can I make sure I'm safe? How can I make sure I have a great accommodation? How can I make sure so then I can really help? And they reached out to me, and after that we recruited a number of the diaspora as a kind of like a pilot, and that was a beginning of looking how the diaspora can really play a vital role in responding to the humanitarian crisis, where the more children were dying because of the famine in Somalia. So I brought them into Somalia, but before I brought them, there was some of the things that needed to be done in it because of they don't want to only to jump on the plane, especially if in the environment where it's volatile, you know, because of the safety and other things. So giving them proper psychosocial support was a great thing that I learned it through my experience because of they were away from the country of the origin, and there were Somali American, Somali Canadian, Somali British. They were away from the country of the origin. As a result of that, they needed it, what I call it, a crash course for cultural orientation, psychosocial support to be prepared. So I traveled with them, some of them on the ground. I visited some of them, and during their tenure, I used to call every morning to just check it, how are they doing in amazing jobs. So bringing a talented African diaspora back to Africa is a really an asset because they were thinking out of the box. They were fired up to make a difference, and they really make an impact. And I remember a couple of doctors who are really kind of like, I remember one of them walked into the hospital, just realized that the hospital was short, there was shortage of beds, more children were sleeping on the floor, and literally he called us and he said like, I needed 400 beds. I said, like, yeah, you're a doctor, but what you need? And then he said, literally, I can see the problem. There are the bed is shortage in the hospital. There are children sleeping, and then they're getting more sicker than before they came to the hospital. That was a great example, and we immediately able to solve the problem within 2 days by buying 400 beds in the hospital. That was a classic example of how diaspora can really think out of the box and help international organizations in responding. The other thing also, I'll take an example of in the case of Liberia, when the Ebola crisis happened in Liberia, there were almost all the humanitarian or health workers who are non-African, non-Liberian, were not willing to travel and respond because of everyone was scared of getting caught of this Ebola disease, you know. And I remember meeting with the community, Liberian American community, at the night of 9 p.m. after everyone get out of the work, and realizing that, talking to them and saying that, okay, here is a thing, do you have a health professionals who can really willing to go back to Liberia and help respond to the Ebola crisis? Almost every healthy professional Liberian American raised their hand, you know, and say they were willing. However, there were some challenges as well because of the assignment was only for 3 months to 6 months. They wanted it to get temporary leave of absence from their employer. That was number one. And number two, the challenge they were facing was stigmatization when they came back from Liberia to the US, how they will be, you know, the quarantine and all those. So we have to get involved with it with the state of Minnesota to make sure that there shouldn't be any stigmatization. And as you know, most of the healthcare workers in the US actually are Liberian Americans, work a lot in that field. Amazing people that I met, amazing people who are willing not only to contribute to their skills, but they felt the sense of responsibility of giving back to the US. When I found it out, there were no proper organization or platform that can help them solve of the small scale, whether it's a travel, logistics, security, making sure they have healthcare insurance, making sure their healthcare is solved. And the three is now the COVID-19. Of course, so, you know, every country there's a shortage of healthcare providers. I remember when the COVID-19 broke out in the US, they were actually saying that anyone who's actually experiencing should reach out to the closest embassy, US embassy, you know. And this was really kind of like alarming for me, saying that, okay, now there's a problem Africa is having. How can we actually make sure to retain? And that coming to the Ilman's point of retention is one of the things that's real African need is it. In the case of, we're looking right now in the Horn of East and Horn of Africa as an IOM, and we have a MEDA program. I know many of you may have known it, you know, migration, you know, for the development in Africa. And this is basically, this program is to bring the Africans who are educated outside, living outside, to help with capacity building in the case of Africa. It's a great program. We piloted in Somalia, amazing healthcare providers. The director of the Ebola crisis of this one of the only two COVID-19 hospitals in Somalia is actually one of the MEDA program from the UK. Amazing. Unfortunately, there was, he got sick, and then we have to also send him back. Now is UK willing to come back, but also he's still supporting remotely. So there are recommendations that I will actually pinpoint, and I will open the discussion later. I will be happy to answer the question Q&As, some of the challenges and opportunities that we see. One of the things I realized in Africa, especially the Eastern Horn of Africa, needs a comprehensive diaspora strategy to engage them. And what I mean is engaging, but as well as implementation, which is really critical. And number two, also, this COVID-19 is sad. It happened. So many people died it. But also, it's important that Africa looks as an opportunity to fix the broken healthcare system. And number three is our retention of the healthcare expertise. Of course, so Elman has already highlighted that one. And now the other thing also, because of the travel restrictions and unable to travel, I think one of the things that we're looking is a telemedicine, because of a lot of the diaspora are unable to come and they're willing to contribute. Unfortunately, they can at this point. So the telemedicine is one of the area that we're looking into this. And also what was missing, and I learned, is there's a need of the diaspora database. We need a database for the diaspora. Each country needs it. If there is an emergency, where to look for, how to reach it out, and how to retain. And number four, which is really important, is a funding. Of course, it's everything always, people, we talk as and organizations, and everyone talks about funding, but I think if we have a good product, funding will not be a problem. And I think designing a good product for a platform, funding will be really very important, especially looking not only from the international European Union donors or the US donors or UK aid, but also looking into public-private partnership. This is important. And funding, what I mean is sometimes, of course, money is important, but most important, the technical expertise, in-kind donations, those are the ones that actually really look at it. What I've learned also in this process is almost everything that is related to medical equipment or supplies are being imported from outside of Africa. Imagine that. If the lockdown, there's no cargo, that would have been a worst case scenario than even. With that, I would like to turn off to Dr. Raji. I look forward each one of you. Feel free to ask me. All the difficult questions should be asked, I think, Dr. Raji or Elman. I'll be more than happy to contribute and answer your questions, please. Thank you again.
Thank you, Abdi Said, for that presentation. You have clearly articulated some of the things that we can do together with the diaspora community as far as the COVID-19 is concerned. You have also articulated the fact that we have a lot of experience to learn from what has happened in the past. You give two very, very important examples, Somalia and Liberia. And of course, you have provided some key recommendations on what we need to do going forward. So without further ado, we'll come back to unpack most of the recommendations, the strategy, and so on and so forth. So without further ado, let me invite my sister and professional colleague, Dr. Sarah Abdel-Galil, who is also, let me say, is a member of the African Task Force on this COVID-19 response and a member of the technical working group on case management as far as COVID-19 is concerned. So Sarah, you have the floor.
Thank you very much, Dr. Taj, and thank you, Iman, and all of the attendants. I'm very privileged to be talking today and listening to Saeed and his examples, practical and very useful. I'm not quite sure if, Gregory, we can share my slides. I'm going to share an example about the Sudanese diaspora during COVID-19. And one of the main things to say why we're here today in the African Union is to share experience and to learn from each other as African countries while we are facing such a serious global pandemic. So COVID-19 has hit everywhere, and I can say that you can see that there are public awareness sort of campaigns in the Easter greeting, a Ramadan greeting, in Eid, and even when we were remembering the 6th of April, which is an important day for Sudan to remember the uprising. But when you talk about the diaspora, sometimes people immediately think about just the financial support and the money that's sent, but actually it's much more than that. So in the next slide, I would like to share with you a background about the Sudan Doctors Union, just for you to know about it. We have, this was started in 1976, and it indicates how is the migration in Africa has been going on for longer than that. But it is a branch to the Sudan Doctors Union in Sudan, and therefore we are linked to them and we follow. It's not just for supporting members in the UK socially and academically and professionally, but as well we are linked to continue to support the health services. This photo was taken in 1985 during the democratic period, where there was a lot of work about rebuilding and reconstruction. In the next slide, I would like to speak about our position during COVID-19. This is different from when we have been involved in fighting cholera outbreak, dengue outbreak, or Rift Valley. This time we were facing COVID-19 ourselves in the UK, and we sadly lost colleagues within the community as well. So it's a triple fight in the hospital, at home, and thinking about Africa and being worried of what's been happening here. What can we do? So as Imam mentioned, there has been an increase if severe cases among the Black, African, and minor ethnicity, and it was not clear what is the problem. Is it occupational? Is it biology? Is it genetic? Is it socioeconomic? And that has affected us a lot. But that did not stop us from thinking about our responsibility to help in Africa. And in the next slide, this is one of the examples that we came together to cooperate and make a coalition between doctors abroad in different parts of the world, from Australia, New Zealand, America, Canada, Ireland, UK, Egypt. And we started sort of this webinars to talk about what are the experience, what are we seeing just before it hits Africa, how can we help? But I have to highlight here that there is an issue about how can we get people to engage in Africa, because Zoom, in Sudan specifically, Zoom is, the accessibility for Zoom with the sanction in Sudan is a problem. And therefore we had to use Facebook to expand the view. There was areas that we needed to concentrate on, for example, occupational health, because in Sudan there was an issue about getting PPE and the shortage and the use of PPE, and that has led to anxiety and extra shortage in health professionals working in the hospital. And therefore, we made this webinar about occupational health, which was very useful. As we know, at the moment in Sudan, the health service is very fragile. And we just came out from a revolution. We were looking ahead for rebuilding and reconstruction of the health services, and then COVID-19 just came as an additional hit. So we were thinking about how can we help. Part of it is trying to send money, but still there is a sanction. So how can we send the money to support the local production of PPE? Because waiting in the queue until we get the PPE and fighting with other countries. And you can see that these are some registrars actually in anesthesia in Sudan. They were trying to make their own PPE. So we were trying to support, but there was restriction. Then from our experience, as we have been facing COVID-19 outside Africa, in Europe, as the wave hit before, we were very clear that oxygenation is an important pathway in the care and management of patients. And therefore, we started to look about the production, the storage, the transfer, about the states and the peripheries, and how can we help. And we realized that you can't produce or synthesize any, or cannot, get cylinders. So we ended buying cylinders from abroad, send it to Sudan, which will arrive tomorrow, and that's about 400 cylinders. And that's a collective work with other diaspora, not only health professionals. In the next slide, I would like as well to, the next slide, I would like to highlight other examples for health professionals, and that may apply to Sudan and other countries when we talk about human resources and about unions and the importance of having unions that can support you during this period and make sure that the health environment is appropriate. So from abroad, we were trying to talk and discuss about unity, about working together, about having independent, reactivated unions, so that you can have your rights and you can work and you don't feel anxious about the availability of PPE, or you put yourself at risk. And I think that's an important message and an important experience that we should share together so that health professionals will be able to participate. To continue on other examples, we have been always in contact with the Ministry of Health and the Global Health, and I would like to bring here an important point about the governance of diaspora participation. That's very important. Where is the right channel? Whom should we speak to? And we are very lucky after the revolution in comparison to before that. So we have access to the Ministry of Health and Global Health and can have a direct contact to ask about the needs. But we felt it's our responsibility to even speak to His Excellency, the Prime Minister, Abdullah Hamdok. And we were very thrilled that he accepted our letter with 5 points about our response and outside Sudan, and how we can see things can get better, and how to avoid things which were not great in our countries where we are working. To be honest, it was a privilege because he read the letter, he discussed it with us, and that in itself is appreciation to the role of the Sudanese diaspora abroad. And but it ended with giving us a task, and he said, I will see whether you will deliver it, and it was about telemedicine. So we are now looking into how can we help through telemedicine, and that's led by SDU Canada. Next slide, and I hope I'm not overrunning my time. Knowledge exchange rather than just knowledge transfer. A lot of live Facebook and recorded videos to the public and to our colleagues about COVID-19 and pregnancy, COVID-19 and children. And that has been ongoing and has been appreciated by the Sudanese public and by our colleagues back home. In the next slide, I would like to highlight that, as I said, in Sudan, we are thinking, or we have been looking into rebuilding and reconstruction. And as COVID-19 is not going to leave us soon, unfortunately, we are thinking about long-term infrastructure, working with other diaspora like the engineers about building oxygen plants and trying to make sure that there is a continuous oxygen supply in other parts of Sudan. The next slide, please. Thank you, Gregory. As part of the telemedicine and supporting health professionals, we have this sort of, I can see, e-teaching, which is providing training for the health professionals, not only doctors, nurses, cleaners, lab technicians, about infection control on a weekly basis. But this is very important because it is for the hospitals that are serving the vulnerables, the displaced, the camps, and areas where there's a lot of population density. And we felt that this is a very good example, working in collaboration with Al-Manar, which is an NGO organization. I think the next slide should be my last slide. Yes, working together, coordination and good communication is important. And a part of our work as well was to work with other organizations like IOM, USAID, African Union and others, even if we can't get the money, is to try to highlight the areas where a need is there. I would like to point to the lower part of the slide where it says Sudanese doctors abroad stand united to support doctors in Sudan to fight COVID-19. We will continue to support. We can't travel. There are travel restrictions. We have to fight COVID-19 where we are, and there is a lot of challenges, but we will try our best from a distance. Thank you.
All right. Thank you so much, Sarah, for that presentation. Though you were over by around 2 minutes, so that's fine. It's all for good. So you talked on the need for coordination, collaboration, and communication. You emphasized the need for partnership. You also talk on the need for political support. Even though you are bringing resources, you still need that political support for you to be able to make meaningful impact. And of course, the need to have a governance structure in place, which key into what Ima and Said already, alluded to, that the need for a clear-cut strategy on the way on the way the diaspora is engaged, and what do they do back on the continent. And of course, you highlighted the fact that right from outset, the diaspora community has been disproportionately and severely affected as far as COVID-19 is concerned, you know. So I understand our third speaker is not yet around. So surely we will be moving on, and that as soon as he's able to join us, we will give him room or the floor to also say one or two things as far as the issue under consideration is concerned. So let me shift gear a bit here. I have some few questions here from our colleagues who are joining us. So the first question has to do with issue of trust. You know, that Said, you talk about the need to have, I think this should go to both Ima and Said, the need for us to have database. So the question is, there is no trust between the diaspora community and the government back home. So how do we navigate this tortuous terrain over? Maybe Said will go first, speaking from the national level. Then Ima can also bring the continental perspective to this. It's all related to the issue of trust. Said, over to you. Can you unmute yourself, Said? You are muted. Unmute yourself.
Oh, sorry. It's a very important question. Trust is broken. And I think this is what we learned in the past. One of the things we learned is in the case of Somalia. I will take an example. I'm a diaspora myself. I've been away from Somalia for a very long time. 17 years after being outside, I tried to give back to Somalia. I said, like, this was not enough. I need to respond. But coming back to this trust issue, in generally in Africa, the trust between the diaspora and the government is broken, but also the trust within the diaspora and also within the country of the public is as well as broken. So how to build the trust? It's not only for coming for a meeting. It is one thing. There's one thing that divides the communities, and then there are things that unite it. So by focusing what divides in the community is a key thing. So when it comes to the humanitarian and the development, it's one of the areas that most of the diaspora, as well as the diaspora and the government, unites because of they want to respond. In the case of Somalia, I remember saying that, okay, here is the thing. When someone comes to me, and I'll take a great example, hey, why don't you be in our region? Why not in our our region? Why don't you respond to this area? So this is one of the things that is very common. What brings people together are three things: food, music, and sports. What divides the community is the politics and clan or tribal system. So I think what we need to focus on, can we actually treat a child who's sick? And everyone in any country will say, and every person will say yes. Can we provide an opportunity to a mother who's looking for an opportunity to feed her children, whether it's a food or whether it's a skills? And then can we create a job for an African father who's really our mother, who are the breadwinners of the family? Can we create everyone, no matter which country they come from? I think that is actually, they will say everyone yes to this. So the trust can be built, but I agree with whoever asked the question. It doesn't take only one day to solve the problem. It's over time, transparency and accountability. Some of the faith leaders, some of the diaspora who volunteered with me to Somalia, I brought them from the US. It was also included a faith leader who was hesitant to work with an international organization. It took me 2 years to bring him on board. I knew that he's very influential. How can I bring him on board? And after 2 years, he was observing what we were doing in the case of Somalia. He came and he said that, now I'm ready. And guess what was my answer was? When are you ready to jump on the plane with me all the way to Somalia? I brought him, he spent 1 month with me, every morning waking up and seeing exactly what we are doing. And I realized that they are the real stakeholders where I think most of the international organizations should engage them. In the case of the COVID-19, I call them, the same imam, the same faith leader. I said, like, now people are having an issue of social distancing. What can we do? What can you do? Because people listen to you. So they are an asset, they are stakeholders. So trust is the key, but you have to bring in a way that is transparency and accountability, and let them be seeing what we are actually doing. In the case of the government, of course, politicians are very tough to be dealt with, but I think it's a very important to be transparent, because of the diaspora should not engage in the politics when it comes to the humanitarian development. And I think that has to be drawn the line in any organization when you're engaging. In the case of the healthcare, I think everyone agrees it. And I know some of the countries right now, they have a teleconference with the diaspora medical professionals giving them advice, the cabinet level or the government level. Another thing also, there are diaspora who are in the government level. They should be the bridge to connect the diaspora and the government. They should make sure that, because they understand on both sides better. And I think that is what I will recommend it.
Thank you, Abdi. Iman, any quick reflection on this?
Yes, thank you, Dr. Taj. I think, Abdi mentioned a lot of things, but, I think I'm privileged to be at the AU, so I get to see the side of the member states, and I get to see the side of the diaspora. So like a situation that we have on COVID in a database, imagine a government now going to the diaspora and saying, please register your details with me just in case this happens again and I want to reach out to you. Most of the diaspora will not sign up, because the question that comes to mind because of the lack of trust is, what do you want to do with my details, right? And you want to text me? Do you want to get my information? This trust is not there, because most of the time, of course, you leave for knowledge, but sometimes you leave for political reasons. So I think that one of the things we do at the African Union is, we know that the trust building is a process, and that governments need to understand this. It is not a one-time, it's not a project, it's an investment. You invest in them, you invite them into, of course, the national days, you see if they have a challenge. Your consular offices need to resolve the problems of the diaspora. Recognition was mentioned, the channels, if they want to provide political support, is there. But I think also that situations such as this, humanitarian situations, are always such a good way to reunite the diaspora and the government, because the interest is one. The interest is the country and the people in the country. A good example of that was Sierra Leone, Liberia, and Guinea during Ebola, because regardless of the situation between the diaspora and the governments, the support that the diaspora communities provided during that Ebola time encouraged the government afterwards to say, let's rethink how we engage the diaspora. And then now they started to rebuild a lot of relationship with the diaspora. So I think that, yes, the trust is very important. It's the step one that you create when you want to create a strategy, and it's a long-term solution. But I think that this is high time to start speaking about it.
Thank you, Iman and Said. So if I attempt to summarize this on the issue of trust, the two of you actually emphasized the need for engagement, proper engagement strategy, and to know the right entry point. And Said talked about the need to make use of our faith leaders. So meaning that we engage our faith-based organization, which, I'm sure Iman has been doing a lot of work on that, together with Africa CDC as part of what we are doing in responding to this COVID-19, you know, and that is very, very important. And of course, the issue of transparency has also been emphasized in terms of engaging our diaspora community. And of course, the last but not the least is we should never waste a crisis opportunity. You know, so COVID-19 has given us a lot of opportunity. We also have a lot of lessons to learn from Ebola, from the famine and all those things in the East, you know, which is a perfect opportunity to right the wrong, you know, to put in place a sort of lasting solution. So thank you so much for those responses. So the next question is on the issue of public-private philanthropic intervention. What should be their role, you know? And again, Said, yeah, you mentioned this as part of your recommendation in terms of getting the diaspora on board. So would you like to unpack this further for the sake of our colleagues who are listening to us this afternoon? Over, Said. Can you unmute yourself? You are sick? Very good.
Thank you, thank you. The public-private partnership is a critical, and I think the diaspora can offer a lot when it comes to Africa. It's not only about the transfer of skills, it's also an investment. And I think one of the audience asked this question about the investment, like the diaspora investment, you know, trustee. On one area that I will critically say is like, and I'll take an example of based on the last 8 years that I was involved in the humanitarian, but more focused in Africa and looking into the ways that to partner with the public-private partnership. I think as many of you know, most of the organizations rely on international donors, multilateral, and so when it came to the partnership, it has to be a win-win situation partnership. And there was one time I remember I was fundraising and someone asked me, okay, I'm gonna give it to you $1. What are you gonna do with your $1, or the $1 that we give your organization? And I remember answering that, I say like, how about if you $1 turns into a 12? Think about like a business. If you $1 turns, and how can you turn on, that was the question. And I think the best way was exactly you need a qualified staff as an organization, and most of the donors are what they do is a restricted funding rather than unrestricted. So the core operational cost becomes a challenge, and that is why many of the diaspora organizations fail. With related to public partnership, it's critical to engage the private sector. Right now, every country is suffering because of the COVID-19 financially, you know, and definitely Africa will have the challenge of raising money to respond and address this health crisis in Africa, and as well socio-economic crisis as well, which is of course many of the African countries cannot sustain right now for the lockdown. So public-private partnership, engaging the private sector's companies, like in the case of each country, like in the case of Kenya, Safaricom, for example, companies like those, Coca-Cola's, all these companies that are actually working in African continent should be engaged in a way that they contribute not only financially, but as well as the in-kind contribution. So it's a really an important, and I know I engaged with money corporate world in both outside in the West as well as in Africa, and it was shocking that I remember one of the things that fundraising or partnership can come within in Africa. I raised money. That was really a great example. I was surprised at it. I was not expecting. And one of the things that I raised the money was because of the diaspora. I brought them. Not only they transferred their skills or they contributed it, but they were the champion of some of the funding that I raised it from a corporate company in Africa itself, because they had these connections. So it's very important that we engage the private sector in Africa, and also we need them to make sure they understand social corporate responsibility, even if it has to be, let them be taken to a Western world and show them how the foundations works out. and how we can turn the $1 into a $14. Over.
Thank you, Said. Again, you emphasize on the need not just to engage them for funding. Let me just share one experience here. At the outset of the COVID-19 response, and we started engaging the private sector. There's this multi-billionaire that was engaged that, look, we put this budget together. The first thing he asked was that, you want money? We said, yes. He said, you never get any money from me. You know, why is it that whenever there is issue or there are issues, the first thing we think of is money, 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 money? How many times have we shared our strategy, you know, with the private sector and let them decide on which area they want to support? Everything's not just about money. You know, we can be a lot of in-kind support. It can be a lot of technology that will be put at our disposal. Again, I think we need to really tweak around our strategy, get it right. And you also emphasize the need to share best experiences from elsewhere. You know, where these things are working. I think we should not shy away from that. Let's copy experience from elsewhere and see how we can adapt and adopt as appropriate to our continent. Again, thank you, Said, for that. So let me shift gear a bit and go to my sister, Sarah. In your presentation, you mentioned the fact that our diaspora community has been disproportionately and adversely affected as far as responding to COVID-19 in the West is concerned. So in your own opinion, what can we do to reverse this? What can we do to change this trajectory? Over, Sarah.
Thank you for this very important sort of question. It was really difficult because what we have noticed in Europe and in North America, that despite that the number of immigrants in these areas was not very high, when we came to the affected and those who died and those who went to intensive care, even the children with primary, who had what we call the systemic inflammatory process, Kawasaki-like, their background was from the vein community. But when you come to see, okay, what are the factors? You know, are they socioeconomic? Are they living in very bad environment? They can't practice social distancing. Is your occupation? They have to go to work. They are the one at the front line, not only as health professionals, but even bus drivers. You know, and therefore they are the one who are, facing the COVID-19. Is it genetic? Is it biological? Is it their access to health services? So their control of diabetes, of their blood pressure, their understanding to the language, they can access the health services, it's affordable, the health insurance. It all comes to the, when you immigrate, to the quality of life that you are living. And I can't press it very hard. There is nothing like being back home. Whatever you try, there are different factors. So we conducted a survey among Sudanese health professionals, and we had a good response, about 240, 230. And we felt that there were factors which are related to, for this group, about risk assessment, about them being shy to access the risk assessment, to determine the risk factors, about them the loss of economic support, that you have to work. Because we have to remember that when we are working, the majority, we are as well helping our families back home. It's not just about our small family, it's about other families. Therefore, I think it is high time to think about COVID-19, the global pandemic. It's exposing a lot of differences and exposing issues about equity and about justice. Thank you.
Thank you, Sarah. So it's all about our risk perception, versus the economic gains of going out to expose ourselves. Thank you. And it's also all about health utilization, about access, about equity. So I think going forward, these are issues that we need to examine critically and see how some of these issues can be addressed. So let me shift gear again and throw this one out to Iman. We know that despite the fact that we have a lot of challenges as far as human resources for health is concerned, We have critical shortages in some countries, critical gap in others. But despite all this, we still have ongoing, I don't want to call it poaching, but ongoing recruitment from the south to the north. So what can we do to address this as an organization, continental body? Over.
Thank you so much, Dr. Taj. I think this is one of the questions why we're having this webinar, to try to understand, what sort of solutions we can come up with. Like I mentioned, at least within the labor migration unit, and again within, supported by the diaspora division here, some of the things we're looking at, and that's when I was saying, where's the balance? It is their right to seek extra knowledge. It is their right to get financial gains, not just because you've went into the medical sector and because you have opportunities that we should stop it. But the one thing that we should speak about is the skill partnership. That's why a win-win partnership has to be put in place. What do we mean by that? We mean that, one, there has to be sort of bilateral agreements or continental agreements that happen between, for example, Sudan and the UK. If somebody goes, right, like you have a diaspora health worker, like a health worker who's moving from Sudan to the UK, for example, there needs to be some responsibilities that are put in place. Are they meant to train people when they go there? And there has to be sort of a formula, I would say, that safeguards the process, that when they go, we will not be lacking in Africa. But I think there's no clear answer as of now to what is the solution. And maybe that's a question I'd throw back to, the doctors, because, sometimes we look for the interest of countries, but we need to also look for the interest of individuals, because they now go in regular paths. And if you stop them, we know that it's, humans remain humans, and they will find other ways to make that journey. So the question is, how do we strike the balance? And I think for me, basically, and I'm not a speaker at this webinar, Dr. Taj, I was someone who was meant to give opening remarks, but basically for me, the question is, how do we strike a balance, and what is it that we can do? And I was hoping that this webinar would provide us with some, sort of insights into which areas we should look at. Thank you.
All right, thank you, Iman. I completely agree with you. There is no one single formula. There is no one single solution. But one thing that is clear that you and Said had talked about is one, the need to address the push factor on the continent. The need to come up with a clear-cut retention strategy. The need to incentivize the profession itself, on the continent. Let me give you an example. When I was still back in the university, as a lecturer at the teaching hospital back home in Nigeria, when the salaries of doctors and the lecturers were actually, increased significantly by the government. In fact, a lot of people from that actually came back home, which is to further, support what Sarah was saying, that there is no place like home. A lot of people came back, In fact, I was shortly after that, I left for Saudi Arabia, but a lot of questions were coming to me. That what do you want to go and do in Saudi Arabia? Already the salary is good. So what do you want to go and do? I just said, no, it's not just about money. It's just about exposure. It's about experience. Let me see what else is happening and what is happening elsewhere, So I think, again, it's boiled down to us to look at what are those push factors, We've talked of the need to incentivize this profession, the need for people to know that there's a career path. When I graduate today, I know that in the next 6 or 7 years, I will become maybe a consultant pediatrician, a consultant gynecologist. 2 or 3 years after, I'll become a director, something like a clear-cut career path, and there should also be opportunity for people to grow. So if you have all these, it will not stop it, but it will surely reduce some of these issues. So I don't know whether Said and Sarah want to weigh in here. What do we need to do to stop this brain drain? Over. Said first, then Sarah can come after.
Well, I think Elman has pointed out, this is really an important question. So sometimes when there is a problem, as you already said, Dr. Raj, I always look the opportunity, and this is really very important to look at it. Africa has a young generation, young population, and I think one of the things that we should also focus on the education sector, the pipeline. There has to be a strategy and balance between educating our Africa youth to make sure there's a pipeline that is available in the healthcare sector, because for two reasons. It can be exported to, I mean, they can go outside, some of them, and of course if they go outside, they're actually bringing resources back in the country. They're going to bring more education, but also more money back in the country. And I think that will also, we look as an opportunity. Also, the strategy for African countries should look, and also an African Union to look, is the second generation, engaging the second generation of the diaspora. Definitely there is a need for the second generation. They have been disconnected from Africa. How can we capture? Because right now, Africans in the diaspora, the first generation are sending money. The second generation will most likely not send them money. So there will be a remittance crisis in 20 years from now, unless there is a solution for that. So looking at that. And also the third is also maybe countries which the countries or the African Union, if there is a platform where the diaspora investment trust can be built, that will be very good, because sometimes the healthcare system can be fixed through the private sector. And I think the diaspora will be willing to invest it. I've seen some of the diaspora who came back and they have opened their private clinics. Individually, it's okay, but I think collectively investing the healthcare system and subsidizing whether it is, we call it as a social enterprise, will be a really great idea to solve the broken healthcare system in Africa, and also minimize the costly, but also most importantly, to stop the counterfeit medications that is coming to Africa.
Thank you, Said. Sarah, any reflection on this? Can you unmute yourself?
Hello. Yep.
Yeah, Sarah, we can hear you. Go ahead.
Yep. Sorry. I have a problem with my phone.
Go ahead.
Just a moment. I have a problem with my.
Okay, so while we wait for Sarah to sort out.
Sorry.
Are you there?
Yes.
Go ahead.
I had a call, so I apologize. Yes, so if we're talking, there are 2 points here. One of them is the return of the diaspora, and the other one is the retention of those like the junior health professionals. So with the junior health professionals, and not only doctors, because we're talking about health services here, we're talking about all different sectors. The most important thing that I believe is the social justice. So if you feel as a health professional that you will have good life, safety, peace, you can feed your family, your kids can go to school, they can be treated, you will stay. But if any factors in this area is not present, then you will think about my responsibility, where should I go? When we come to doctors, there is an important issue that I think Taji will agree with me. The quality of the training. As you said, the career path. If you have good training and you feel like you will achieve your path, and you will have a recognition, not financially, academically, then this may as well help you, or may give you the incentive to stay. Now, if we come to returning back, there is a good example in Ghana. Well, for a long time, nurses from Ghana, used to go back to go to the UK, and they are like considered as very professional. Everybody is happy to appoint them, but they are going back now home. Why is that happening? Because health, environment is better. They can work in good hospitals. They can be paid well. They are recognized socially. All of the other factors that we talked about is back. In the meantime, what is the interim? What can we do? The interim is what Iman is suggesting, that there should be a scheme about, if I want to go back home, first of all, there should be a governance, to make sure that I'm really a qualified doctor that can work in Sudan. Doesn't mean that I'm coming from the diaspora, that I'm a good doctor and I can just immediately get there. There should be some consideration about how I can, as you said, the crash course that I take, how can I engage there and practice after being for 19 years in one system, how can I engage in the other system? And then we can't deny things. The financial part plays a role. So I hope that will answer the question.
Thank you, Sarah, for that response. You emphasized the need for to also look at return of the diaspora, you know, and Iman has talked on the need to have a governance structure in place for that, the need for basic amenity, good working environment, and so on and so forth. I hope we have all this captured in the report at the end of this webinar, so that we have something to put out there for colleagues, both in diaspora and on the continent. So let me move forward a bit and look at the Intra Africa itself. We have people moving from one country to the other. We know this is quite common in the southern part of the continent. You know, so again, I know Abdi should have a lot of experience dealing with this. You know, we have a lot of movement towards South Africa, you know, and this is within the continent now. So is there anything specific that we can do to address this intracontinental movement, what I would call South-South migration? Can you unmute yourself? Good.
Yes. Yes, I think if I understood it correctly, how we can solve the problem of South-South migration. You know, Africans within moving from one place to another place. Of course, sometimes, so here's the way I look. There are three types of diaspora. One is the diaspora, I call them the local diaspora. So they're already in the country of their origin. And then there is a regional diaspora, which is within Africa. And then you have other international diaspora in the West and Middle East and other continents. So within the ones in right now in the COVID-19, after the lockdown, in some countries like in the that we're actually helping, there is a problem of shortage of medical professionals. And it really helped us to find people within the South to help another country. So this is a great example because of the distance, you know, distance matters, you know. So that is one thing. Locally also, we found out some, we're still, you know, there are so many health professionals that international organizations are looking for. This is the time where even some of the healthcare professionals working with the ministries of health in Africa may think of looking for jobs of international organizations because of the pay. So there's a problem right there. So retaining, I think it's a very important to help an Africa and come up a holistic approach how Africa can help and benefit from each other at times of this difficulty, and look for in terms of a meaningful collaboration, meaningful show that Africa can really make a difference within, because there are so many talents in Africa. Unfortunately, again, the problem is how to engage and how to look for the diaspora within Africa. I think we don't invest in much, and I think that is where I see the biggest problem, is we don't invest in much in engaging the diaspora or engaging the diaspora in a very meaningful way. It has to be a win-win situation for the diaspora, for the government, for the governments, as well as the international organizations, private sectors, African Union. There has to be a win-win situation for all. I think that will work. But I see there's a great opportunity from the COVID-19, even though it's very sad, it's very bad. I see this is the time that Africa is thinking, even thinking itself. Now we have a serious problem. If there was a shortage of the logistics, or there's no logistics, Africa would have suffered. So there's a great innovation coming up. I've talked to a number of, I think, social enterprises, innovators, thinking about within Africa, thinking about coming up with the creativity. I saw there's a young man in Kenya on the social media, came up with a skill, how to wash your hands without touching the machines. That was a really classic example. Another one in Somalia, the oxygen. young Somali who's really come up. So there's a great opportunity for the innovation, and we have young generation, and I think we need to benefit from each other. Of course, Sierra Leone, or I think was it Senegal, came up with a very cost-effective testing COVID-19. I think it was on the Al Jazeera, if I recall very well. I hope I answered the question.
No, thank you. I think you touch on one key point here, the fact that we should not view this just from the negative perspective alone, the fact that this can also be an opportunity to acquire more skills, an opportunity to gain more knowledge, an opportunity to build local capacity, and an opportunity for what I would describe as technology transfer. So again, thank you, Saeed. So moving on, there is a question here that is looking at how do we, that for now, when you say diaspora, most of our private sector look at it as, oh, these people that just want to go and look for greener pasture, people that just want to leave the continent and so on and so on to go and enjoy, So how do we change that narrative? In essence, how do we rebrand diaspora so that people see it from the positive perspective, and not just from a negative perspective? Maybe I will allow Iman to take the lead on this.
Thank you, Dr. Taj. I just want to weigh in to the previous question a little bit about the South-South aspect, because I think that there's a lot of, when we speak about now diasporas moving within Africa, basically within the AU's definition, that we don't consider them as diasporas, then they become health migrants. But I think there is a lot of values there, One is that if they can move as health professionals or whoever works within the health sector, whether nursing, midwives, etc., it means that there is recognition of skills within the continent. So it means that we've achieved one point, that there is recognition of skills, that you as a Nigerian, for example, can go anywhere on the continent and your certificates will be recognized. So this recognition of certification and skills is something that we are working towards at the African Union. And I think that there's a lot of advantages. I share Abdi, in being such an optimist if this has happened, because one, and nursing was put as an example. I know that in Sudan, for example, and many countries in Africa, nursing was not looked at respectfully as they look at being a physician, even though the role that they play is so important. So for example, if you have the nurses coming from Ghana to any other country where this is the situation, then they will see how nurses carry themselves, their role, how they're respected, and I think that will be able to change mindset. The second thing is exposure again. Ebola, for example, those who worked within the Ebola context have been able to share a lot of knowledge with this COVID-19. And that's why you see that these countries are so prepared, more prepared than many countries in the West, because they've been through this. And they're now, within Africa CDC, Dr. Taj can speak to this, that these are the same health workers who are going to support other countries during COVID. Another thing that I think that can also be an advantage is when you speak about these systems, it's much easier to come from Ethiopia, for example, and go to, South Africa, and not South Africa, but any other country in Africa, but and be able to take the knowledge that you've gained there and apply it. We're closer when it comes to culture and to social and to practices, that it's much easier to apply these lessons learned. And finally, especially that we speak about telemedicine, telemedicine we can't think technology and think that it is limited to one country. This doesn't make sense. When we speak about telemedicine has to transcend borders. Having somebody who's able to use their phone to get a consultation, it doesn't matter if the doctor is Nigerian or Ghanaian or Sudanese, as long as they can speak the language and are skilled. So I think that also speaks about this South-South aspect where we can support each other. Now, your question, Dr. Taj, was about the diaspora and the private sector, how people look at the diaspora. I think if you look at the diaspora in just a negative manner, then you basically don't know much about the diaspora aspect. We already know that the diasporas, Somalia as an example, Eritrea as an example, where they have been supporting their countries fully, for not 5 years, 10 years, but for decades. At the end. And I think that speaks about real contributions of the diaspora, and the real impactful contribution of the diaspora is well known. Social, economic, And most families in Africa have somebody in the diaspora who's already supporting them. In addition that we always advocate to have diasporas abroad, because when we have somebody, you know, like Dr. Tedros at WHO, he speaks for Africa, you know, like, so having these diaspora at these important places is the impact of this is well known. And I think that if that's how, you know, private sector views us, then, you know, we're able to speak to the private sector within their own language to explain how the diaspora can contribute and are contributing to the continent. Thank you.
Thank you, Iman, for that. You've clearly articulated the positive side of this intra-African movement. Thank you for that. So let me invite Sarah here again. We know that the diaspora is doing a lot to support the continent in terms of responding to COVID-19. Is there anything we can do to allow our Western government, you know, to be able to support this great initiative that is coming from our diaspora community? Over.
Yes, we can. We have to have a very loud voice where we work. We work at the front line. We are part of the communities where we live now, wherever we are. Some of us have dual even nationalities. And so we have to see what sort of gaps we can fill for, you know, in Africa. But first of all, we have to as well raise sort of the recognition about how, you know, Africa and how it is unique and how it can be special and all of the positive, you know, factors that we do have in Africa. So when people now talk about when COVID-19 hit Africa, what will happen? We have a lot of information, data to collect that all of the, you know, scientists and research all over the world, we need this data so that they can help in producing a better sort of understanding and management of COVID-19. So we have to represent Africa in a way that will be fair for our colleagues and for our countries. Now, coming to practical, you know, sort of steps, we obviously can apply for global funds. We have done that through, for example, the UK DFID, and we understand, for example, our countries. We can know where are the gaps. We have open links, and therefore we can represent that better and know where are the areas that we can have. We can as well links with hospitals and have twinning with academic institutes. We can modify some of the protocols. And I think there is a lot of factors that we can bring from here and there so that people at the end of the day, we are saving the human race. So we are doing the same job in both areas. I would like to say that there is an important aspect that we have to build on, which is the allied health professionals, and that we have to think not only about doctors, we have to look at the whole team, and we have to build the whole team, because this will improve health services in Africa. It's not just about one, not the other. And that, as well as we said, nurses, technicians, the staff, the cleaners, all of the dietitian, all of the sector, this concept is very important. I would like just to conclude by saying we have to as well move away from having expertise from outside Africa that has to be non-African and that they are different. We have the expertise. So if we have someone from the diaspora who has been there for 20 or 30 years, he should be welcome, or she should be welcomed for a talk when we talk about academic, for example, training. But some people feel that, you know, they still want the non-African expertise to come and deliver the training. And we have to advocate for the fact that we do have an expertise within our diaspora. I think that's all I can say at this point.
No, thank you, Sarah. You've talked on the need for advocacy, and you have also talked on the need to leverage on the different resources at your disposal over there in the West to support our member countries. So let me throw in the last question. I actually left this question to the last. So in terms of brain drain, there's been a lot of talk on the need for compensation, on the need for the North to compensate the South. So let me start with Iman. What is the status of this compensation back home in our respective countries? Over.
The compensation of the North to the South?
Yeah, in the aspect of brain drain.
Okay. Well, I think there's a lot that we can do, and like if there's anything physically that we're putting in place, no. There have been, you know, like these things can be dealt with, like we mentioned earlier, through bilateral agreements. The challenge here is that most countries have not signed these bilateral agreements, and there has always, until now, there's always been a point of contention. A great example, and I was speaking to a colleague of mine today within labor migration on this, is that sometimes one of the articles that are put when you want to compensate for this brain drain aspect, or like even regularizing, you know, like the schemes for doctors or like health, professionals, like Sarah put it, sometimes some articles are put there. For example, like the return and readmission. And that brings two issues that are dissimilar into one basket. So I think that we need to separate these issues to make sure that we move forward in this matter. Most health professionals who go in a regular manner. Most of the return and reintegration is an irregular aspect. The root causes for the two might have some commonalities, but they're very different. The support is different. So I think that we really need to come up, and that's what we wanted to say. We really need to think of continental frameworks of bilateral agreements, or have sort of a framework where we say, how is it that we manage this? Because yes, I don't think somebody needs to compensate, but I think we need to now as Africa realize country by country where the brain drain is and which aspects we need to, as a country, invest in the development of our countries.
Thank you, Iman. So if I get you right, it takes two to tango. So it's something. So thank you, Iman. So I think we have come to the end of this special webinar that's actually looked at the challenges and solutions for addressing the skills shortage and its impact on Africa, using COVID-19 as a case study, and using this opportunity again to address broader issues as far as diaspora is concerned. We've talked on different aspects of this. I will not attempt to summarize all that we've discussed because one, time, and two, we have discussed a lot. But I believe that the rapporteurs for this webinar must have captured most of what has been discussed. And I also believe that the report will be shared with each and everybody that has been part and parcel of this webinar. So with that further ado, I would like to hand over to the organizers at this point. Let them do the honor of giving us the closing remark. Thank you. Organizers, over.
Good afternoon, Dr. Tajuddin. Thank you so much for your support and for moderating this today. I'm Stella Opokowisu. I'm the Deputy Executive Director at Ford. And together with AU-CIDO, you've met Ayman, and with Karine, who will introduce herself shortly. We've been organizing these 3 webinars that have been looking specifically at diaspora and COVID-19. And this was the 3rd one, which was looking more specifically at issues of diaspora health professionals, and also looking at skills shortage on the continent, which has been a really interesting discussion today. And we really appreciate all the inputs as well. I will just hand over quickly to Karine, just so she can introduce herself, and then I think we will basically wrap this up.
Thank you very much, Stella. So I'm Karine Sudu. I am ADEPT Executive Director. Thank you for this very insightful discussion. Thank you for the recommendations that were put forward by the issues, the difficulties that were raised during this webinar. It's very important for us to have that sort of interaction, that sort of feedback, and it will feed into our advocacy work, our advocacy activity. Please don't hesitate to reach out to us via the email address ddd@adeptplatform.org. And if you have further queries, some particular comments, and we will get back to you. So thanks again.
Thank you very much, Karine. So I think, as we had mentioned, this is the third and the last one. The first one was looking very much at diaspora practices in terms of what interventions people were actually making on the ground together with governments around COVID-19, and that enabled us to identify some good practices. The second one looked at remittances and very much at short and long-term solutions, or rather at even emerging problems, which was very much around, for example, the fact that MTOs are not necessarily an essential service, and trying to push for that, but also it looked at the cost of remittances and also just developing more structures around collective remittances. And this third one, of course, has looked very much around the issues of health professionals, and also I think that discussion around should we be looking at some sort of compensation scheme in a sense for developing countries is definitely something that we would like to look at a little bit more. But I think also quite pertinent to today's discussions really was just the current climate as well that we find ourselves in, which of course started with the BLM, movement with Black Lives, Matters and all of that. I think it really has allowed all of us to have a look really at the structures that we see, that we feel are unequal. But I think it's very much also about what can we do? How can we address this? How can we also focus much more also on younger generation, on second generation diaspora? So in terms of even discussing all of the issues today on the impact on diaspora, on health in particular, I think it's really important for us to take another view as well when we're looking at this in terms of how we drive that forward. I think it was Dr. Tajuddin who had mentioned that, or someone, I'm sorry, had mentioned that in Ghana, for example, you have quite a number of professionals who have been going back from the diaspora. And I think it's the same in other countries as well. You have quite a number of young diaspora or second generation diaspora who have been going back as well, because they can see the opportunities there. And I think it's quite important for us at this time to also think about that second generation as well, and how we work with them in terms of going forward and strengthening the continent in various aspects as well. But I'm going to leave it there, and just to say thank you to everyone. Amen. Dr. Tajuddin, Saeed, Sarah, Angela, who's been supporting as well, Karine, and colleagues from all the organizations and institutions at the AU who've all been supporting. There will be a report that will come out of all of this, which will be shared. And we will also share, as we did before the recording as well, from today's webinar. So thank you very much for all your support.
Thank you.
Have a good day.
Thank you so much. Bye.
Bye.
Bye.